There's new hope on the horizon for patients with an aggressive form of blood cancer. Dr. Leo Gordon is here with advocate Megan Gutierrez to tell us a little bit more. How are you two?
Hello, good morning. Nice to be
Good
with you.
morning.
I'm happy to have you both here. Dr. Gordon, I want to start with you. Can you tell us about this type of cancer and how it differs from other non-Hodgkin lymphomas?
Yes, so diffuse large B-cell lymphoma, or DLBCL, makes up about a third, a little bit more than a third of the roughly 80,000 cases a year of non-Hodgkin's lymphoma. And it's unique because it's a fairly aggressive form of non-Hodgkin's lymphoma, which means that with upfront treatment, actually, which is aggressive chemotherapy, we can expect a cure perhaps in anywhere from 50 to 60% of patients. But we are left with an additional 40 to 50% who may not either don't achieve a remission initially or after having achieved remission may relapse at some time later. And that's the group of patients that we're talking about. We have options such as bone marrow transplants for those patients, but if that's not successful, we've up till now anyway, had fairly limited options.
And how common is DLBCL and what are the risk factors for developing it?
So again, roughly about 80,000 cases a year, a third are DLBCL. So the 80,000 cases of non-Hodgkin's lymphoma put it number 7 or number 8 in the frequency of malignancies in the US. Risk factors we're just beginning to understand. Age perhaps is one. The median age is about 60, although it can occur in people in their 20s and 30s, and then later in people in their 80s and 90s. We do know that immune suppression in one form or another, either from medication that people have to take to suppress the immune system, or from other factors such as viral infections. We did see an increase during the HIV epidemic, an increase in non-Hodgkin's lymphoma, presumably because of immune suppression. But we're just beginning to study the molecular events that occur that lead to this. And I think those, as we understand those better, those molecular events will give us a better clue about risk factors such as perhaps environmental or dietary risk factors.
Dr. Gordon, can you tell us about the new treatment options that are available?
Sure. I would say also that my role here in this is as an investigator on the pivotal study that led to the approval of this, and I'm not being compensated for my time, but the new treatment is basically an attempt to harness and weaponize our T cells, our immune system, to attack the lymphoma. So different from chemotherapy, different from radiation therapy, different even from most bone marrow transplants. This is a direct attempt to allow our own T cells, our own immune system, to attack the lymphoma. So in that way, it's quite unique. And we've seen responses and long-term responses in as many as 50% of patients where we expected perhaps only maybe 5% to get responses. There are some side effects that we have to be aware of, blood pressure drops, fevers, and sometimes neurologic changes that can occur in some patients. But we're very excited by this whole new approach, which is sort of based in science, based in good science.
And Megan, what do you think this means for these patients?
Well, unfortunately, as Dr. Gordon has shared, diffuse large B-cell lymphoma can be an aggressive or fast-growing form of the disease. And when patients relapse, they and their families often must make important decisions about their treatment very quickly. And up until recently, they've had limited options. As a result, new treatment options mean new hope for these patients.
What resources are available for those interested in learning more about these types of treatments?
At the Lymphoma Research Foundation, we know that a well-educated patient can be their own best advocate. Patients and their families can visit our website at lymphoma.org to learn more about every type of lymphoma, including a dedicated learning center for diffuse large B-cell lymphoma. We also have materials about all of the different treatment options currently available, including CAR T-cell therapy. It's a core part of our mission to bring information like this to patients. And so I wanted to mention also that we aren't compensated for our time today. Experts, including members of the Foundation's Scientific Advisory Board, like Dr. Gordon, assist us in creating the most up-to-date materials and programs for patients. And our helpline can offer support and resources on a one-on-one basis. And these materials and resources are always offered free of charge.
All right, Dr. Gordon and Megan, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.